Welcome to 4sight Friday Roundup, 4sight Health's podcast series for healthcare revolutionaries. Outcomes matter, customers count, and value rules. Hello again, everyone. This is Dave Berta, news editor at 4sight Health. It's Friday the 13th. That's not good, people. Watch out for black cats, ladders, and mirrors. Never stay on the 13th floor of a hotel. Don't take a hit on 13 unless the dealer is showing a 10. And avoid 13 in a game of 21 on the basketball court. It's poison. Here are two other numbers we're going to talk about on today's episode of the Roundup, 13.6 million and 6.1. Both are records, one good, one not so good. Can you guess what they are? To tell us what those numbers mean for the future of the healthcare industry are Dave Johnson, founder and CEO of 4sight Health, and Julie Murchinson, partner at Transformation Capital. Hi, Dave. Hi, Julie. How are you guys doing this morning? Dave?
Not walking under any ladders nor stepping on any sidewalk cracks and avoiding all black cats. Otherwise, doing just peachy, Dave.
That's great. Julie, how about you?
I, of all people, am fighting with CVS.com to pay for a prescription. So I've had better days right now.
Ouch. Good luck with that. Thank you.
Thanks.
Now, before we talk about what those two numbers are and why they're important, let me ask you about your superstitions. Dave, are you superstitious about anything? It sounds like you are. And do you have any rituals to ward off bad luck?
I'm actually not superstitious at all, but I'm certainly aware of superstitions. When serving as a Peace Corps volunteer in Liberia, West Africa, I coached my high school soccer team. That was a big deal in a community of 10,000 people. We always had a few thousand spectators at our game. When I got to the field one day for a big game against the rival high school from across town, I immediately noticed that the players from both teams had arrived early and were standing on the 4-foot retaining wall surrounding the field. Some quote unquote African doctor, think voodoo, had convinced the players that whichever team touched the ground first would lose the game. Unbelievable, right? And it took me 30 minutes with the other coach to convince the players to all simultaneously jump down from the wall so we could play the game. Peace Corps, toughest job you'll ever love.
Wow, that's interesting. Thanks, Dave.
Oh, there's far more if anybody wants to indulge in that subject sometime.
That's great. Julie, how about you? Do you rub any rabbit's feet before you do anything?
I will say I have crossed my fingers or my toes or my legs or something every time my daughter hits a volleyball or some big thing is about to happen. And I notice that I'm really thoughtful about not crossing more than one thing at a time. So I think I do have a little superstition in me.
That's interesting. Like you're avoiding the double negative or the double positive. Yeah, no, I get that. Well, I'm Catholic, so I see signs everywhere. But my most secular superstition is picking up a penny. I have to pick it up if I see it, even if it's in traffic. If it's heads, I'm going to have a good day. But if it's tails, I get a little itchy. So now I haven't seen one today yet, so we'll see how the show goes. Good luck to all of us. Let's talk about this first number, 13.6 million. That's the total enrollment in ACA marketplace plans this year, according to new data released by HHS. That number is a 21% increase over last year and a new record. And if you add in Medicaid expansion enrollment, that number jumps to 35.8 million. That's also a new record and a 16% increase over last year. Dave, what's your reaction to these record ACA enrollment figures? Who's the winner and who's the loser? And where do we see these numbers going in the future?
Well, more Americans with health insurance is a universal good. All Americans should have access to affordable health insurance. There are no losers, but that doesn't mean there aren't nuances. And on the nuance front, I'll make two big picture observations. First, and this has been widely reported, the coronavirus relief legislation funds most of this increased enrollment through more generous subsidies on the Obamacare exchanges and a prohibition against removing any Medicaid enrollees in exchange for higher Medicaid payment to the states. These temporary funding measures, however, will likely end this year. If not renewed, the provision increasing Obamacare subsidies will expire by the end of the year. And as soon as the Biden administration declares a formal end to the public health emergency, states can begin disenrolling unqualified Medicaid patients. And that could be as early as this summer. So this enrollment jump is likely to be temporary, and that's unfortunate. The second nuance, which has hardly been reported at all, is the impact government outsourcing of its lower paying insurance programs. Think exchange-based plans, Medicare Advantage, which is also at record enrollment numbers, and managed Medicaid programs is creating a fault line between providers and commercial payers. So as the government outsources more of its health insurance coverage to commercial insurers, providers are starting to push back. So examples of this fault line include Mayo Clinic's decision not to provide elective out-of-network coverage to Medicare Advantage enrollees of United Health Group. United has more Medicare Advantage enrollees than any other insurer. And also there's a major brouhaha here in Illinois between Blue Cross Blue Shield and the Springfield Clinic. Springfield Clinic has 66% of the market in Greater Springfield, home of Lincoln. And the clinic canceled their contract with the Illinois Blues for the 10,000 exchange plan enrollees the Blues have in their plan, 10,000 in the Greater Springfield area. So since we were talking about Africa earlier, there's an old proverb that goes, when the elephants fight, the grass gets trampled. So I'm not worried about Mayo or United or Springfield Clinic or the Illinois Blues. But the greater this gap gets between the higher paying commercial treatment rates and the lower paying governmental rates, as the government pushes more and more of its insurance volume to these private commercial payers, the greater the providers need to maximize their traditional commercial contract revenues. So the strong payers and providers will be just fine, but they will demand concessions from the weaker players, and this will exacerbate the already deep structural flaws embedded within the current healthcare payment and delivery models. So the moral of the story, let's celebrate the higher enrollment figures while they last, but it's going to be a while before we see them again.
Got it, Dave. Thank you. Julie, any comments or questions for Dave?
Dave, this is more of a simple opinion question than anything else, but given what we're seeing happening with inflation rising so rapidly, where do you think healthcare is going to fall on the consumer's plate when they're faced with the impending changes?
Well, Julie, I'm full of opinions, which is nothing wrong with asking those. I mean, I'm hearing rumors that commercial insurance rates over the next 2, 3 to 4 years could be up as high as 30 to 40%, with everything that goes with that, right? Higher premiums, higher deductibles, higher copays. And that's coming on top of the first real inflation pressure we've seen since the early 1980s. I remember the early 1980s. That's when I learned about arbitrage, because I didn't have to pay my tuition for graduate school until the last day of the semester. So I took all my money and put it in a money market fund and earned 8 or 9% interest. So a few hundred extra bucks over the course of the semester that I was able to apply to the payment. The universities got smart and eliminated that. I do think healthcare is going to contribute, maybe disproportionately contribute to inflation pressure, which is going to put real strain on kind of everyday Americans. And the health systems, providers in particular, are starting to struggle with volume issues as well. So I think they're going to be doing everything they can to get as much payment in the door. So my opinion is that this inflation isn't going away in healthcare, and it will probably exacerbate rather than relieve the overall trend in the country.
Yeah, that's great, Dave. Thank you. And I'm sure that extra $100 and $200 bought a lot of pizzas while you're in college.
$600 or $700. Remember, this is when treasury rates were over 10%.
Wow.
Yeah.
I wish I was your roommate. That's
no, you don't.
That's great.
I lived in a broken down tenement in Somerville.
Got it. All right. Now let's talk about the other number that we mentioned in the intro, 6.1. That's the firearm homicide rate per 100,000 people in the U.S. in 2020, according to new data released by the CDC. That's also a record, up from 4.6 in 2019. That's a nearly 35% increase in the rate from one year to the next. Oh, and we topped 1 million COVID deaths this week, another record. And we had a record number of drug overdose deaths last year, 107,000. Julie, you're stuck with the half empty part of the show. Sorry about that. What's your reaction to the CDC gun numbers? What's the public health impact? What's the provider impact? And can providers do anything to help stop the violence?
Yeah, this is the fun part of the show.
Yeah.
First, let's talk about the COVID numbers for a second. I mean, the craziest thing I read about passing the million death mark is that it would be like losing the entire state of Delaware or the entire state of Rhode Island or the entire population of Austin, Texas in just 2 years. So if you just actually really think about some of those movies where people disappear, or they blip or whatever, I mean, it's kind of stunning. So what I'm also surprised by is there didn't really seem to be a lot of fanfare around it. So it just goes to show the exhaustion that everyone has from all of this. So on gun violence, this is a stunning statistic. And I'd love to say that I'm surprised. But with the pandemic's impact on equity in all sorts of different ways, rapidly rising inflation, creating some pretty significant insecurities among some of our most vulnerable and impoverished communities, violence seems to have become the answer. And what I was surprised by is that the suicide rate is actually largely stable. Suicide rate due to firearm gun violence is largely stable. I honestly would have thought we would have seen a bigger bump there too. But Dave, your mention of the drug overdose deaths setting another record, it seems to me like we are committing suicide through overdose and less turning to guns. So it's all bad news, that's for sure. When I look at the disproportionate effects this is having on Black and Brown communities, Black men in particular, what's happening, I'm sure, in a lot of the hospitals is just overwhelming. And, providers have been put in a position, especially in the ER, to do a lot more to referral mental health issues, to start to provide guidance and advice on gun safety and gun storage, especially in those states with pretty liberal gun laws. So we're putting our doctors in a position to, I think, really embrace mental health, which it should have been for years now. The problem is we have a lot of options to put people in associated acute care centers or acute care centers across town, but we don't have a ton of ambulatory options for these ER docs to refer to. And when should a doctor be responsible for talking about gun safety? Like, do we have to train all of our providers and ERs about this? So I'm distressed, honestly, about kind of how we're trying to deal with this right now. That's for sure.
Yeah, Julie, thank you. Great interpretation of the numbers. Dave, any comments or questions for Julie?
Yeah, this isn't an easy one, Julie, because there aren't any easy answers to it. But in talking about the provider response in the ERs, it's really addressing the problem after it's already manifested. In just listening to your discussion and these devastating increases in gun deaths, particularly in low-income Black and Brown communities, beyond provider responses, is reframing gun violence as a broader public health crisis necessary to address its root causes? And if so, why? And what are the implications of attacking the problem in this way?
Well, I'd hate to think that it's necessary to reframe it as a public health issue, but I'm not so sure anyone else is going to pick up the ball and run with it in terms of responsibility. We're certainly not seeing our elected officials doing that. So it may be. And what's interesting is there's actually a lot of great work going on right now, looking at the impact of efforts like greening up parking lots and how that decreases violence in those specific areas and in those neighborhoods. That's the same kind of public health effort we've put in place broadly in cities by putting in bike lanes and greening up boulevards and things like that. Researchers have seen things like income tax credits that can reduce violent crimes as well. I think there's something like income tax credits reduce violent crimes by 10%, just like affordable housing and childcare subsidies can reduce and help with violence prevention. So there's a lot of different ways to think about this. There's also some interesting work going on from Wales, actually, that's being implemented or at least piloted in Atlanta, where physicians, law enforcement, and community leaders are working together to identify, based on hospital-driven data about where these patients are coming in, the geographies where violent injuries are coming from, and then developing really deep interventional strategies in those locations. So you are seeing those kinds of disruptive collaborations coming together to try to deal with it upstream so that they don't show up in the ERs or in the hospitals. But it would take a tremendous effort. And I can see healthcare taking on more and more responsibility for this, which is not where healthcare needs to be right now.
That's fascinating, using hospital data to look for insights that lead to interventions. So that's definitely a new role for hospitals. Interesting. Thanks, Julie. I have a number of friends who aren't hunters, but who are gun nuts nonetheless. And it's not like we all grew up in a crime-ridden neighborhood. So I guess I just don't get it. We'll see what happens over the next year or two. Anyway, tough challenges ahead for healthcare, that's for sure. Now let's talk briefly about other news that happened this week. Julie, anything else catch your attention and why?
Well, the news that Atrium in North Carolina and Advocate Aurora in your neck of the woods are merging was shocking to me. And it was shocking for one very simple reason. These two systems are not regionally connected. And we've been talking for years about the fact that we're going to end up with 7 to 10 mega systems at the end of the day. And I had to really think hard about the fact that I think COVID slowed us down because we've been so focused on getting care to people who need them and just staying afloat, right? And all the ways we talked about today. But I think we might actually start to really see this hospital consolidation speed up again.
All right, there goes your future tax base. That's very interesting. Thanks, Julie. Dave, what else happened in healthcare this week that's worth noting?
Oh, that's the one that caught my attention too. AA Advocate Aurora becoming AAA with Atrium, with the new headquarters in Charlotte. And when all the dust settles, there'll be over $25 billion in annual revenues and the fifth largest health system in the country. The FTC still needs to approve the merger. If they do, and I suspect they will, for the reasons Julie stated, I think we really can benefit from consolidation in the sector. Nobody blinks when HCA takes over a system in an entirely new market. The big question is going to be, will the new AAA system not only be bigger, but will it be better? Time will tell.
Thanks, Dave. And thank you, Julie. That is all the time we have for today. If you'd like to learn more about the topics we discussed on today's show, please visit our website at 4sighthealth.com. If you follow our show on Apple Podcasts or your favorite streaming service, you'll get notified each time a new episode is available. And don't forget to tell a friend about 4sight Friday Roundup. Subscribe now and don't miss another segment of the best 20 minutes in healthcare. Thanks for listening. I'm Dave Berta for 4sight Health.